My name is Richard Bamford. I'm a surgical trainee in the Severn region, and I'm going to spend a few minutes talking to you about your ARCP. Your ARCP is often considered quite a stressful time. It's something that trainees are very worried about, and I think that's because it really puts all your work from 1 or 2 years all together in one place. It's often linked with progression, and it's often seen as an assessment of your competency as a surgeon. But really the ARCP there is to help guide you and support you and help you become a better surgeon. And that's why you're asked to record all the evidence that shows that clearly online on the ARCP website, which is then used by the training program directors to evaluate your progress and see whether or not you need extra support or help in order to progress to the final point of completing your core training. Your ARCP are really not designed to be used as a tool to discipline you or to worry you at all. They are there as a supportive mechanism, but you do have a responsibility for your own training and to ensure that problems that affect your training are flagged up and dealt with appropriately. That means being dealt with by your local educational supervisor, your surgical tutors, and where appropriate, taken all the way up to the training program directors. You also have a responsibility to help find a solution to any problems and ensure that your training meets the required standards. And whilst the training team of your supervisors, surgical tutors and TPDs are there to support, advise and help you through that process, the only person who's going to miss out and suffer in their training will be you if there are problems that you don't actively go and help out or actively try and solve. So do take that responsibility seriously, because that's the key thing to progressing well if there are problems within your training. To help with that, we've produced 2 videos where you'll see 2 ARCPs happening. They're the same trainee, or me, who is having the same problem with his training, but he's dealt with it in 2 completely different ways. It's based on a real-life scenario, which I personally have experienced, and I hope that by having a look at it, it will give you an idea of what you might do to ensure that your training meets the required standards and making the best out of a bad situation, even if it feels as if all else is lost. Take some time to have a look at it. They do show the whole process from before you walk in the room of an ARCP until after you've left. And that includes the conversation amongst the panel, which is a key feature for deciding how you're doing. Nothing really should come as a surprise to you in an ARCP. You should understand what's happening and know what the impact of what your portfolio shows will have. I hope you find it useful, and please don't hesitate to get in contact with anyone on the training team if you have any questions about your upcoming ARCP.
Okay, so this next candidate is Richard, who is working in general surgery. In a vascular post, yes, thank you. He's in a vascular post. So this is his logbook. I had to look at this last night when I was adding up his logbook numbers and his WBAs. So I'm a bit concerned here because he's a bit low on his overall numbers. He's got 73.
Yeah.
Really, over the time period, I would expect him to have had more than this.
Yeah.
Of those 73, he has converted 36 of them to supervisor, trainer, scrub. So he's getting involved in some of the operations a bit more proactively, but the overall numbers are a bit low. I don't know if anyone has any thoughts on that.
I just want to know what he's got 24 unsupervised operations.
But if you look actually, because I did look at this, 12 of them are putting in an arterial line. Because I
Oh,
think
right.
he's done the ITU post as well, so
Okay.
6 months vascular, 6 months ITU.
Yeah,
so,
yes, that's correct.
you know,
Yeah.
whether, I suppose putting an arterial line in is a
It's
sort of
not,
operation, but it's
yeah,
not.
it's
You know.
not. Maybe for an ITU post.
Yes, yeah.
Okay.
But what about sort of a
Let's look at the, because as you know, we look at the appendectomies as a guide because
Yeah.
the rotations are so different. So, where
Oh gosh, she hasn't done any because
I can't see any on here.
No.
Okay, so that's a worry because in most, even in a vascular job, I would expect during the on-call for the trainees to have some experience of appendectomy. And the number, it's always difficult to gauge the numbers, but if they're doing 6 months general surgery, I'm usually looking for at least about 15 appendectomies in that period, with them getting their hands on as many of those as possible. What do you think about that?
Yeah, and within the first 12 months, starting to convert from assisting to doing with the supervisors.
And if they've done 12 months general surgery, then the numbers for appendectomies need to be higher than that. Okay.
But we haven't seen anybody else today with such a low number, or
No.
none at all.
No, these numbers are lower.
Yeah.
It's not even on there, is it? Which is unusual.
No, so he's not got into theatre with any appendectomies at all.
You've got to ask them really,
Yeah.
find out why.
Okay. So,
Looks like he's not taking,
WBAs.
not taking his MRC as part of
so we need to find out what's happening with his exam, because a year down the line he really ought to have his exam by now.
Yeah.
Otherwise he's going to struggle with his ST3 application next year, which was actually only going to be 6 months away from the application. And I'd be really looking for at least a couple of two closed loop audits at this stage as well.
I've not started an audit or quality improvement project, which it's not great at the end of the first year, is it, not to have even
started one,
considered one?
He's attended only, it looks like you pointed out that he's attended only 40% of the training days.
Yep.
So there's not enough evidence here for it to be a 1.
No.
And when you look at his work-based assessments, they are down, aren't they? What's the numbers we were thinking of? 20 and
40 and 12
14,
months.
12 months. So,
Yeah,
so,
that's on their global objectives,
Yeah.
and that's explicit on the trainee contract on their global objectives, and they're explicitly told that on their induction day.
So if he's only done sort of 25 in his first year, he's down, isn't he,
Yeah.
compared to other people?
He's not had any mitigating circumstances, has he?
He's not contacted me about anything. I did advise him to get in touch with me so that we know as things are going along, if there's any problems.
We can ask when he comes in.
So if there's no mitigating circumstances, then he certainly can't get an outcome 1. And he's probably looking at an outcome 3 with some extra time.
He'd find it difficult to catch up in a month or 2 if we gave him an outcome 2.
Yeah, he's never going to be in a position to successfully compete for an ST3
So
post.
needs an extra 6 months.
The question is whether he's got any problems outside work and things, because there's lots of things which are lacking.
Yeah.
Might be worth having a word with him.
The other thing
Like
that-
support or anything.
The other thing that sort of strikes me is there a problem with this part of the rotation that we don't know about?
We
Because
don't know,
it'd be
yeah.
very strange not to have done an appendectomy.
Even,
Yeah.
even assisted an appendectomy,
Yeah.
yeah.
It's like,
Yeah.
ooh,
Agree.
what's going on at that hospital? But,
I think there's a potential warning signs around the job, whether there's anything happening in his personal life, which of course he's not obliged to discuss with us, but can just flag it up. Needs any help or support there, and otherwise just see what the other option is. Maybe he's no longer wishing to do surgery.
Yeah.
Because sometimes when across the board people just aren't engaging, then that sometimes is a warning sign that they're
Sure.
looking at other opportunities, because they have to decide quite early on. So shall I get him in?
Yeah.
Yeah.
Would you guys come in?
Hi.
Come in, have a seat.
Hello, hi.
Right.
hello. Come on in.
Hi.
So I'm Caroline, we've met before, I'm the
Yes.
Programme Director.
Hi.
Hi, Andrea Cannon, a neurologist from Taunton and surgical tutor.
Hi.
I'm Jeff Pearce and I'm a lay rep.
Okay. I'm Bala, I'm one of the colorectal surgeons from the Midlands.
Hi, nice to meet you.
So, since we last met, how have things been going for you?
Okay, it's been interesting, it's been difficult at times, but it's been good.
Yeah. What's been difficult about it?
It's a quite demanding group, the vascular team that I work for. They expect a lot of hours, a lot of time. As me, I spend a lot of time at work.
Okay.
I find it hard to get to theatre.
Okay.
I spend time in theatre. I spend a lot of time managing patients on the ward, which is fine, but it's difficult to then get into theatre and actually get much operation done myself.
Okay. Are there no house officers?
There are. It's just an expectation that they're looked after by the house officers, I think.
Okay. Okay. Has the panel got any questions at the moment?
So you're telling us you can't get to theatre?
I do struggle to get to the vascular theatre. And I get there, but I can't do very much myself. There's a lot of people there already, and there's
Because your portfolio shows us that the number of operations that you've been involved in has been a lot less than we would expect, and a lot less than everybody else we've seen today, for instance.
yes, I think that.
So we wondered why that
Okay.
was.
What about getting into theatre and emergencies?
Oh, I'm not on the on-call rotor, so I
What?
don't go to.
What is it?
I'm not on the on-call rotor.
Is that because you don't want to be on the on-call rota? You got a personal problem that you're not on the on-call rota?
No, it's just that's what I have for my job. They just haven't put me on the rotor.
Say that again. You're not on. You don't get banded. You're not paid for on-calls.
I'm just an unbanded job and I'm not on the on-call rotor.
And you've been doing this for the last 1 year.
Well,
Nearly
6 months, yeah.
bit more than 6
Yeah,
months.
so I did my first job, the vascular
Yeah.
job, I wasn't on the on-call rotor at all, and I'm now doing ITU, so I do ITU on-calls.
But no surgical on-calls.
No.
And who's your AES?
Mr. Jones,
Did you speak to him?
about,
Not being on the on-call rota.
no, I assumed he knew that.
And did you let the program director know?
No. No, again, I assumed you knew that was the job.
No, because if you're in a surgical post, we accept that with intensive care that you wouldn't be on call for surgery, but when you're in a surgical post, then there was an obligation that you have some emergency surgery experience as part of your
Okay.
training. And one of the things that we look at this stage is your logbook numbers overall,
Yeah.
and that's difficult to measure exactly because everyone's doing something different. Some people do urology when they get high numbers,
Yeah.
some people may be doing vascular, as you say, when the overall numbers would be low. But one of the things a couple of things that are constant, so your appendicectomy levels
Right.
and the hernia levels, because you should be on the on-call rota and have
Okay.
the opportunity to get to theatre to do appendicectomies. So at this point, I'd be looking for you to be hitting at least around 20 appendicectomies
Okay, right.
for a year.
Okay.
And we modify that if you've been in ITU for 6 months.
Yeah.
So it's not absolute, and of those appendicectomies, now, a year down the line, I'd be expecting you to have converted those, a proportion of those, to supervisor, trained and scrubbed. And if
Right.
you're doing vascular and ITU and you're not on the on-call rota,
Yeah.
you're not getting any emergency surgery experience. Is
No,
that,
that's
what you're saying?
fine. Yeah.
So that would be news to me.
Oh, right. Okay.
Okay, that's a concern.
Is that why you haven't got any appendicectomies recorded on your logbook?
Yeah, I've not been to emergency theatre to do any appendicectomies.
Okay. Okay, and were you expecting to be on the on-call rota when you started the job?
I guess so. And then I got there and I wasn't, and I assumed that was all.
So
Well,
are there any other core trainees in the department with you?
There's a CT2, yes, and they
Yeah.
are on the on-call rotor.
So did you ever discuss why they were and you're not?
No?
Okay. Okay. Did you discuss it with the consultants in the department?
Well, they know
Right.
that I'm not on the on-call rotor because I'm with them all the time. But I didn't discuss with them specifically about that.
Okay. Let's move on from there a minute.
Okay.
Perhaps come back to it a little bit later on.
Yeah.
What about your WBAs?
So I've started doing a few WBAs, but again, it's quite difficult to get them to do it.
Okay.
I find it quite hard to engage with people to do the WBAs.
What are the barriers for you?
Finding a registrar who's willing to sit down and do it. Some of them don't like the computer system. And finding the cases to discuss has been quite difficult.
Okay. Any thoughts from anybody
Yeah, we
else?
can see that you've probably done like half the number we'd expect at this stage, and,
Okay.
and of the numbers that you've done, we do like to see sort of about 50% of them done by a consultant.
Oh, right, okay.
You know, what we've said to sort of other trainees is it's good to sort of log onto the system in theatre, have it up there and try and get it validated at the time, because there's one
Okay.
thing doing it and the second thing is validating it. And,
Yeah,
you know, what
okay.
a lot of consultants don't like is they receive all these emails to validate them
Yeah.
3 months afterwards, and none of us
Okay.
can remember that, so
Yeah.
it's really good to do it at the time.
Okay.
But you know, having said that, your numbers are pretty down compared to what we'd expect at this stage.
Yeah.
And
Okay.
although I appreciate you've not done on call, and you know that's probably a problem within the system that we weren't aware of, and on call is a good opportunity to do them. You've obviously
Okay.
still had a lot of time in vascular and ITU where you perhaps
Yeah.
could have done some more.
Okay.
And maybe that's something you know you need to look at continuing.
Okay.
Okay. What about your exam?
I'm going to do it at the next sitting.
Okay. Have you sat that this year at all? The exam? In the
I
last 12
can't
months?
say I did as an F2.
Okay.
Partly I've got on the next. I'll do next sitting.
Okay.
Have you applied for it?
No, not yet.
When's the next sitting?
I think it's February.
How do you expect to be sitting it? It's already January and you haven't applied for it.
You might find that you've missed the deadline. Do you know what
Okay.
the deadline is?
No.
Okay.
Okay.
Okay. I just need to look into that a bit more. Is there a reason why you haven't sat the exam in the last 12 months?
I guess I was thinking I'd be better if I had a bit more experience behind me before doing a clinical part, and that would put me in better stead to be successful first time round.
Okay, I can understand that. There's a lot of pressure for you though to leave it to the last minute, and you'll very shortly, if you're going to progress, if you're wanting to apply for an ST3 post, you need to be putting the application in soon,
Okay.
and you need to have the exam to be in a position to put the application in.
Okay.
Because the application doesn't come at the end of your 2 years, it
Yeah.
comes halfway through your 2nd year.
Okay.
So you really need to have all your ducks in a row as far as you can by the end of your 1st year, and just be
Yeah.
tying things up over a couple
Okay.
of months and then put the application in. That's how I tend to see it anyway.
Okay.
Can I ask when you last met with your clinical supervisor or your educational supervisor?
Um,
We couldn't find it
So-
on the system.
anyway, I see them every day because they're my consultant, is my clinical supervisor. My education supervisor I met with probably 3 or 4 months ago. Last time we had a sit-down meeting.
Is that documented on your ISCP?
I don't know. I see, we were doing something on the ISCP at the time.
Right.
I don't know if it's.
While they're trying to find that out, it looks like you've done the CRISP course.
Yeah, we did the crystals. Yeah.
Very good. What about the ATLS and BSS?
So I did that as an
So
F2.
you've done all the
Yeah,
courses?
so I've got those.
Good.
That sort of audits and quality improvement projects, we were trying to look into that, but it might just be that you've not uploaded them or...
I didn't know you could load them on there actually, but I've not done an audit, but I've started a research project with the vascular team I was with first,
Oh, right, well done. Yeah.
looking at venous outlet syndrome, classic outlet syndrome.
So that's a research project, all
Yeah.
right. And was that ongoing then? Is that something you can continue?
So that's what we're still working on, sort of the data and the collection, and we're putting that together, yes.
And have you thought about audits and or quality improvement projects as well? Is there anything?
Not yet, I think the research project really sort of took over most of my time, but
Yeah.
it's something that
It's probably really important to sort of be competitive,
Okay.
going into your STD jobs for sort of to, one of the things they look at is not just doing an audit but closing the audit loop. That's scored really highly, so it takes quite a bit of time to design a project, set it up and then close the loop, so
Okay.
that's probably something that you need to get started on pretty soon as well.
Okay. Thanks.
Okay. Richard, I wonder if you would mind stepping outside for a couple of minutes
Okay.
for me. We'll call you back in a second.
Okay, fine, thanks.
What are your thoughts? I'm quite concerned about him, really.
He's obviously not getting the help he needs.
No.
Whether he's asking for it, whether
Yes.
he's proactive enough.
No, I mean, I disagree to that. I don't think, I wouldn't say that he's not getting the help. He hasn't made an effort. He hasn't even informed anyone that he's not on call, which is quite
And he
a
sees,
dramatic thing, yeah.
sees a clinical supervisor every day, but not about his training.
Oh,
Last saw the educational supervisor 4 or 5 months ago.
Except in fairness, we ought to know what's going on a training programme, and I agree he should have spoken up and said, hey guys, I'm not doing any on call, but obviously his team know he's not on call and they've not raised it as an
And
issue.
the other thing is, as did we know from the program that this slot didn't have an on call?
I didn't know. I know all the slots on the programme, and I'm normally be expected to be informed if there are any changes. And I just don't really know what's going on here. I don't understand.
It's something we need, probably you need to
Absolutely.
write to the college tutor in
Yeah.
that trust to find out.
I think we need to
What's
be careful
happening,
because it's not his fault, is it? And
No, it's not his fault, but,
He- perhaps another trainee might have
yes,
spoken
so
up about
he
it.
hasn't Yes, it's not his fault, totally his fault. He hasn't made an effort to
Address it as an
address
issue.
it to it as an issue, and also there are other things which are lacking in the. It's just not the on-call, isn't it?
I think that's my concern. He seems a little bit naive or uninformed as to what's expected of him in this
Yes, yeah.
training programme.
Yeah.
I think if it was just the fact that he's not been on the on-call rota and his emergency surgery numbers were down, that would be, I could accept that if there's been an error
Yeah.
somewhere. I'm more concerned about the fact he doesn't seem to have any engagement with the ISCP,
Yeah.
understand about the WBA. He hasn't even got his exam by now.
Yeah.
Most of the good guys have got their exam and they're
Even on
ready.
getting the exam, he
Yeah.
hasn't even applied for it.
No, he doesn't. I don't think he really knows when the sitting is.
And although he's doing the research project, he's not really thought about audit, and it's all these things that they need to be
Sure,
competitive
yeah.
for the next stage.
And it's
of jobs.
easier to get an audit
Yeah.
than getting into a research. Nothing against a research project, it's going to take him some time. He could have got a couple of audits in the meanwhile, especially with the fact he's not even doing on calls, he would have had more time.
Exactly right. If he's not on call, then he could be using his time usefully. I mean, we've all written, we've all wrote our papers in the evenings for sure.
Seems a really nice chap, though,
It does,
doesn't
doesn't
he?
it?
You know,
Yeah.
and I think, obviously, I presume the outcome's going to be that he needs more time, and maybe he just needs coaching and a better understanding of the process and what's expected of him. And
Yeah, I mean,
I do feel that as a committee, something's gone wrong, and it's not
Yeah, I think
totally his.
exactly,
It's
yeah.
not totally his fault.
So the options at this point, he's not eligible for an outcome 1 because his logbook numbers are too low, his WBAs are too low. We can't give him it's not
He's
so
not
much
done
he
any
hasn't got the
projects.
exam, but he's not showing progress along the lines that you would normally expect at this stage. And if he continues like this, he's not going to be competitive for an ST3 job, and that's part of our roles to make sure that they're prepared for their applications. Whatever the reasons for him not being on call, he does have a professional responsibility to be in control of his training and to flag that up. There's plenty of us available, so he does have a responsibility to be proactive and flag up any concerns. And I'm not aware that anybody has been informed about this. Nobody's informed me as program director.
as a program lead, I think I would probably ask you to look at that job.
Yes.
for
But we have to
next year.
assess the job, see what's happening with that.
Because if it's not worth sending everybody to the same
Yeah.
post if they haven't got any on-calls sorted out by now.
I agree. But I think we can't really change where we are now with Richard, and I don't think he's going to be in a position to progress with an outcome 1, so he's looking at an outcome 3, which
Okay.
mandates him for another 6 months training.
Yeah.
And that will help him in the long run, because if he progresses eventually to a registrar post, he just wouldn't be comfortable functioning at this level because he hasn't got the experience. So
Can we set him some clear objectives for the next 6 months, please?
yes, okay. So he will be going into a general surgical post next. I know that. So I think it would be reasonable to set him a minimum of 10 appendectomies
In 6 months?
in 6 months. 8 or 9 of those. Eight of those STS.
Yeah, fair enough.
He might struggle a little bit with that if he's not done any
It's
at
not done
all.
any at all. Yeah. We've got higher numbers.
So if we said 15 overall, and then
8 tests.
Eight
eight,
STS,
yeah,
yeah.
okay, so let's do that. But I know that the department he's going to, he will definitely get that sort of exposure. So,
And also that they know, isn't it? Because they'll be expecting a CT2, and that what they're actually getting is a CT1, isn't it?
Or
Yeah.
break junior CT1. So that's his logbook. WBAs, I mean, we say 40 for the year. He's behind, but so if we said realistically in 6 months, 20.
I think so. Yeah.
Minimum 20.
Minimum
He
20.
needs to take control of
50%
that.
validated by consultant.
Yeah,
He needs at least one closed loop audit.
yeah,
And all that is achievable where he's going.
yes, absolutely.
And
Yeah.
apply for the exam.
Sit
Yeah.
the exam, I would say.
Pass
not
the
apply.
exam. He will need to pass the exam.
Yeah.
He needs to use whatever help is available if there are other things, other problems,
Yes,
including maybe training support.
yes, I think that's a good point. Certainly trainees that come in this situation, sometimes they come saying, oh, well, it's this, this and this, but sometimes there's stuff happening at home that we're not aware of, so we can at least flag up that there's the training support unit at the deanery that they can go to in confidence, and he can see them if he feels that there's something happening he doesn't want to discuss with us here. So, okay, right. So is everybody comfortable with that decision?
Yeah.
Okay.
Richard, come on back in.
Hi.
Hi Richard, come and have a seat. We've had a little chat about what's been happening to you this year. I have to apologise, I don't know myself why you're not on the on-call rota and you should have been.
Okay.
Unfortunately, this far down the line, as it wasn't flagged up to anybody,
Yeah.
I can't change what's happened in the last year, and we have to work with where we are right now.
Okay.
And the fact is that overall your logbook numbers are too low,
Okay.
and your WBAs are low. You don't have your exam,
Yeah.
and you're not really in a situation to be competitive for an ST3 application,
Okay.
and you also haven't done enough for us to sign you off for this year.
Right. Okay.
Is that a surprise to you?
A bit, yeah.
Okay.
But okay.
I don't think anybody around the table disagrees with that.
Okay.
That we have an obligation to make sure that when we sign you off for the year that we feel that you have done what is expected for the year.
Okay.
And things do happen, personal and work related, that can affect that progress, but
Okay.
nonetheless, at this point, we have to decide whether you're able to carry on to CT2 or not.
Okay.
And we don't think that you've, for whatever reason, had enough experience to progress to CT2.
Right.
So I'm afraid we're going to have to give you an outcome 3.
Okay. So what does that mean?
That means that you would have 6 months extra training.
Okay. So then
So-
it kicked off.
No, you're not going to be kicked off.
Okay.
No. So you have, whereas normally from here you do another 12 months,
Yeah.
and the next few months normally you'd be eligible to apply for an ST3 post to move
Yeah.
into at the end of your CT training.
Yeah.
If you have an extra 6 months, you'll have to defer that application for another year.
Okay.
But I think taking into account where you are now,
Yeah.
this is actually a positive thing for you because you're not going to be ready to apply effectively, you're not going to be able to function effectively as an ST3 even if you were able to get a job,
Yeah.
and so we're really just giving you some extra time in training
Okay.
to enable you to move on
All right.
further down the line, okay?
Okay. Do I have to do the same job again?
No, you carry on your rotation
Yeah.
for the next year as planned,
Okay.
and then at the end of next year we'll provide you with another 6 months training in a
Right.
job somewhere in the region. I can't say
Okay.
where or when.
Next,
Where or
he's
what,
asking
but-
whether the next 6 months he's going to do the same job, isn't that?
So the additional.
Well, he's
6
got
months-
another year planned in a different department, so
Yeah.
you're going to general surgery next.
Yes, I am. Yeah.
So that follows as normal for
Okay.
next year.
Yeah.
But this time next year, I will be giving you another 6 months in another job.
Right. Okay. Fine.
And then you'll get an ARCP. So we will see you in 6 months' time in the January ARCP slot.
Okay. Yeah.
To make sure that, because we have to set you some targets
Yeah.
now, and so we need to make
Okay.
sure that you've met those targets.
Fine.
Okay?
Okay.
You clear about?
Yeah.
Okay. So we've set you targets in all the areas that you need to be achieving in.
Okay.
We recognise you've not been able to see any appendectomies, but we'd like you to get to 15 appendectomies in the next 6 months, and 8 of those we want you to be doing supervisor trainer scrubbed.
Okay.
Okay. You need to be doing 20 WBAs in the next 6 months.
Okay.
50% of those need to be consultant validated, but they all have to be validated to be recognised.
Yeah. Okay.
And we'd like you to do at least one closed loop audit.
Okay.
I'd really love to see you pass the exam, but you have to at least have sat it.
Yeah. Okay.
And I'm just a little bit concerned, it may be that you perhaps didn't realise what was involved for you, but part of your professional responsibility is to inform yourself and take control of your training.
Okay.
And it may be that you've just fallen foul of something that's happened beyond your control, but I would have expected that to have been flagged up by yourself, if nobody else,
Okay.
if there was an issue with your
So I
training.
thought it was just a
Yeah,
known
okay.
thing then.
And sometimes trainees in this situation tell us it's to do with one thing, but actually there's things happening at home or personal issues that
Okay.
they don't feel they want to discuss or it's appropriate to discuss. That's fine, this isn't the forum for everyone to have those conversations, but there is a trainee support unit in the deanery that you can go to in confidence. If you want them to feed back to me, they will do, but if you don't,
Okay.
then I never get to hear about it. So
Alright.
just bear that in mind, just in case
Thanks.
something else is happening that you don't want to discuss with us today.
Okay.
Okay?
That's fine. Thank you very much.
Are you happy?
Okay.
Okay, is that all right?
Yeah.
Okay.
You've got to be careful when you come for the next 6 months ARCP. If you have not met these targets,
Yeah.
we won't be in a position to extend your training again.
Okay. Yeah.
You may be in a difficult, sticky situation where you may have to leave the rotation, not, you know, frightening
Okay.
you or anything, just to be aware.
Yes, I think that's a really good point.
Yeah.
You can't get 2 outcome 3s.
Right, okay,
The next one has to go up to a 1.
okay.
And just on a slightly different note, you may not feel this is appropriate, but if you're going to be competing in surgery,
Yeah.
you're competing with a lot of other very competitive candidates, and we do usually recommend that you come to your ARCP in a suit,
Oh, okay.
looking
Okay.
like this is your annual assessment,
Yeah,
and
okay.
because that's what we're trying to do, is prepare you to go on to ST3 applications and interviews, and how you present yourself,
Okay.
and having all these things organised and ready, part and parcel of that preparation. Okay?
Okay. Right,
So turn it around for the next 6 months and we'll see how things go. Alright?
thanks.
All the best.
Good. Well
Thank
done.
you.
Good luck.
Good.
Thanks.
Okay, so the next trainee is Richard. He's been very mature about the situation because he started off, he had 6 months vascular and 6 months ITU. In ITU, they don't do on-call, obviously, for general surgery. But he was supposed to be on the on-call rota for the vascular surgery slot, and when he arrived, this was a job that was didn't have any IT on-call allocated to it.
Oh, really?
So it used to be a research job, and then we were able to increase the numbers, so we had a post that we could use, but within the department they overlooked the fact that that particular slot wasn't associated with any on-call because it used to be a research post.
Yeah. So in danger of having a year without a call.
Yes, yeah. And especially with it being vascular, no on-call, so no general surgical exposure whatsoever.
So did he do anything about this?
He did. He very cleverly picked it up and flagged it up to a surgical tutor who contacted me. By the time we were in discussions about that, it was too late to put him on the on-call rota during the first 6 months. But because there was no on-call associated with the intensive care job, we're able to put him on the general surgical rota in the second 6 months. So all of his general surgical experience is condensed really into the second 6 months.
Okay.
But
So
still,
he didn't settle for an easy life.
no. But you know, he was informed himself about what he should be doing and took the appropriate steps and escalated the problem sensibly. So I think we have to credit him with that. I mean, his numbers are still a bit low. He's had 115 overall through the year, and some of those are ITU procedures.
We just been through it, isn't it? He's done
Yeah.
10 appendicectomies supervised, trainer scrubbed, so it's not bad for someone who hasn't done 6 months of on-call
Absolutely.
and then from
Yeah.
ITU point.
Yeah. So he's been in 20 appendectomies all in all, and 10 of those he's converted.
Yeah.
So we perhaps just need to give him a nudge in the circumstances to
Yeah.
move that conversion rate to
Push himself a
slightly
bit
higher
more in
next year.
theatre. Yeah.
He might have lost his confidence a bit, you know, not being on the on-call rota in the first 6 months, so just needs to perhaps give him a bit of a boost. WBAs are fine, 45 of those, we asked them for a minimum of 40, and 50% of those are consultant validated. They're all validated, but 50% are validated by consultant.
It says here about the exam, he's done Part A previously, and he's applied for Part B next month.
Next
Yeah.
month, so if
So-
he should ideally get that in order to get some time to be competitive enough for the interview
If
the following
if he gets that
Yeah.
out, if he gets that out of the way, he can go into theatre a bit more as well.
It's really going to need that because the application is going to be coming out fairly quickly. I think the second year they always feel they've got 12 months before
But
they
then
apply for
before
an
they-
ST3 post.
through
It's really 6 if
Short,
they're lucky.
isn't it?
Yeah. So all in all, I think he's had a difficult situation. I think from what I can see, he's worked hard to turn it around and make the best of it. But he is going to need a lot of support next year
Yeah, to make sure.
to make sure that he's up to speed
Yeah.
and has
Is
been
he
able
going
to.
to a sort of a busy job next year?
He is, yeah. He's going into a busy general surgical job next.
Sure.
So.
Should be able to compensate for that, yeah.
So I suppose in my head, when I was looking at this last night, knowing the background, I was thinking the decision for us today, and it will depend a bit on the conversations that we have with him, will be, do we give him an outright 1, or do we give him a 2 with some targets but no extra time? And that may depend a bit on what he says and how.
It also depends on, there's a little bit here he's written about research and projects, and it looks like he's been quite busy, isn't it? So we can ask him about those.
I think we need to really have a chat with him.
Absolutely, yeah.
There's a lot of things are not his fault in the first
No.
place. Yes, it could have been better, but I think he's done reasonably well. But let him come and tell us what he is.
Come in.
Hi.
Hi Richard.
Hello.
Hi Richard.
Hello.
Hi. Hi.
Come on and see.
Thanks.
So we've met before.
Yes.
Andrea Cannon, urologist at Taunton and surgical tutor.
I'm Jeff Pears, I'm a layman.
Hi.
Hi, I'm Bala. I'm a colorectal surgeon in the Midlands.
Nice to meet you.
Okay, so I've briefed the panel about your difficulties last year,
Yeah.
and the fact that you started off on the vascular slot and then found that you weren't on any on-call rota.
Yeah.
But I have said that I thought, and I do think, that you dealt with it in a very mature fashion by flagging it up to your surgical tutor and then contacting me. And that you've been on call, if I'm right in thinking you've been on call through ITU.
Yes. So when I started it appeared it was a hangover from a previous job that had been a part academic job that hadn't previously been on the rota, and so when I started they just hadn't changed that into a rota position. And despite meeting with trust management and the surgical tutor at the trust, we couldn't turn it into an on-call rota while I was on the job, which is a bit frustrating. And although it has now been put onto the on-call rota for the person doing the job now, I hadn't had any experience in on-calls at that point, so the ITU had agreed through quite a difficult conversation that when I was on call on the ITU rota, they would allow me to do on-calls on the surgical side instead of covering ITU. So I now, although it's slightly different in that I'm not on call by myself, so there are 2 core trainees on call at any one time. We both do surgical on calls as opposed to ITU on calls, as a way of trying to pick up the numbers that we do. We also then had some slight difficulty with numbers in theatre and getting to theatre as the on-call SHO. And for when I was on call, it was quite nice because there were 2 SHOs, so we had time to cover the emergency take and get to theatre, which gave us the idea that actually having 2 SHOs on call to do that would be beneficial. So we spoke to the surgical tutor and he agreed for us to create an informal on-call rota for the emergency theatre.
Are your colleagues happy with that?
And the SHOs it worked out there are 8 SHO core trainees in the trust, and through on calls and various other commitments, it works out that we can have 1 day during the day of being allocated to the emergency theatre, because you don't get time when you're on call to go to the emergency theatre where we are. So instead of that, one person can come out of their elective work to go to the emergency theatre, which the elective team are happy with, and it then frees you up to spend all day in the emergency theatre.
That's good.
And this was your idea?
So it came out of the idea, because it was so beneficial having 2 of us on call and one of us could go to theatre, that it came out of that idea. So we asked if we could expand that, and that worked out well.
Well done. Good. Okay, so when we look at your overall numbers, taking into account the problems that you've had, although normally I'd expect a few more numbers on your logbook,
Okay.
I think in the circumstances we're happy with what you have and how you've been able to turn it around. You've been to 20 appendectomies and you've done 10 of those.
Yeah,
Next year you just need to be mindful that you need that conversion rate to be higher.
yeah.
So you don't need to be watching half of them anymore. You should be doing most of them with support rather than watching half. And I think how you dealt with the problems this year has been very excellent, but you're still overall a bit down on your experience. I think you're going into a busy surgical job next, so you just need to push a bit harder to get yourself into theatre again to compensate for the problems that you've had this year that weren't your fault.
Okay,
Okay.
thanks.
WBAs, I'm happy with that. You've got 45 and half of those. They're all validated and half of those are validated by consultants. What about the exam?
So I spoke to my educational supervisor about my exam, because I was concerned about doing my exam without having had the exposure to the emergency surgery side of things.
Fair enough.
And when I should do it, and we agreed that delaying it may not be a bad thing for me for years. So I've paid and booked on to the next setting, which is next month.
Okay.
I'm revising now, so I'm hoping that will be successful then. I know I've left it a bit late, but we felt it was better to do that after experience on call than doing it and potentially failing through lack of experience.
Good luck with that. As you know, you'll need to have that exam to successfully apply. The applications come around in the next few months, don't they?
Yeah.
Okay. Any other comment?
Can you tell us a little bit about the sort of research audit of the projects you've been doing?
So with not being on call on the vascular job, I had a bit of time, so, and they were expecting a research person, so they had a research project ready for me, which was looking at outcomes in patients with venous thoracic outlet syndrome, and they have a slightly different protocol at my trust to the national protocol, and it was looking at the outcomes of people who've had that. So I've been through the data that I've collected, I've written the article which has been seen by my consultant at the moment. He's checking it through, and then it'll be sent to vascular journal to be peer reviewed, to be published there.
That's a positive outcome for them not having the on-call, isn't it?
Absolutely.
Well done.
And then audits, we've done the first phase of a cycle in audit. We're looking again through the vascular team, looking at maximum blood ordering schedule. And that, again, I think perhaps because I was on call, it appeared that we were cross-matching everybody who was having any operation in vascular, and that seemed to not be right. So it turned out there wasn't a maximum blood ordering schedule in the trust. So we've created one for vascular, or we've done the first bit of looking at what's currently being ordered, and we're in the process of creating a maximum blood ordering schedule with a combination of a committee of consultant vascular and anaesthetic guys who do the vascular surgery to create a schedule, and then we're going to see if that makes a difference to either patient outcome and whether that is useful and that is too much blood.
And have you got a sort of a time scale to close that so that you?
We would hope. So we looked at the initial gathering data, it took 3 months. I hope that we'll have a blood ordering schedule that's done within the next month, and then a couple of months worth of education before we re-audit. So hopefully by halfway through next academic year, we'll have completed that. The first phase I submitted to ASGBI, that's been presented there.
Okay, well done.
And we're going to the aim is to put the complete cycle into ACID for next year.
You might just have that closed for you by the time the interviews come
Hope
around.
so.
A little bit tight. You
Yeah.
work quite hard on that, won't you?
Yeah.
Okay.
And you're doing your postgraduate certificate. Well done.
Yeah, absolutely.
Started.
Again, it came that I had more time to. I started teaching, and I hadn't realised I enjoyed teaching, and I've started enjoying it. Doing it. Where I am, you get off a discount to do the postgraduate certificate, so I thought I'd take the opportunity and save some money at the same time, which is why I'm doing that.
Good. So you'll find teaching very helpful for you with your exam, actually.
Okay.
Very beneficial. Okay. I think we might. Anyone have any other comments?
No.
Might just step outside for a couple of minutes.
Sure. Okay. Thanks very much.
I suppose we could ask what his career ambitions are and whether
Yes, we should do that.
whether
yes.
you wanted to give him
Yeah.
any tips or any suggestions at this
Okay.
stage.
Well, we
He's
still do
obviously
that.
doing
That's a good
well.
point. Yeah. What are your thoughts then?
Clearly he's a motivated
Yeah.
young surgeon. It was unfortunate that he wasn't on the on-call rota. That's why his numbers are a little bit low. But he's made use of the time for certain other things. He hasn't got the exam, but there's a reason for that,
Yeah.
which he clearly
Great.
explains. I would be pleased to give him outcome 1, but just ask him to be mindful of the fact that he needs to achieve these things. It might be worth having a little informal meeting with yourself or somebody over the next few months just to make sure that he's on track for his final ARCP.
Yeah, I think that would be worthwhile. I agree. I'm happy with the one. Are you?
Very.
I mean, this isn't someone that's taken a negative situation and just let it go. He's taken a negative situation and generated a whole load of possibilities and opportunities out of it. He's doing his teaching, he's doing his certificate. All of that will broaden his CV. He's got research out of it. He's changed the on-call rota. I think this is just the sort of person that will do well in surgery.
Yeah.
And I think in a busy job, I think he'll be absolutely fine. I don't have any concerns that he's going to use this as an excuse to keep us, to set the bar low. So, good. Yes, thank you.
Richard, come back.
Hi. So because there were some kind of concerns about your logbook numbers and what have you, we just needed to have a discussion about what sort of outcome we should give you.
Okay.
The options would have been a 1 or possibly a 2, but we
Okay.
feel that you've taken this difficult situation and turned it around in a very positive manner, and we're all happy that you should have an outcome 1.
Okay.
You still have slightly lower numbers than we would hope for, and
Okay.
whilst we're happy for you to proceed to CT2, we are trying to prepare you for ST3.
Sure.
So I think you'll have lots of opportunities in your next job, but you just need to push quite hard to make
Okay.
sure that you compensate a little bit for what's happened this year.
Okay.
You do that because I can see that you take the opportunities when they're there, so I'm not really concerned. But we thought just as a backstop, you perhaps ought to, do you want to come see me in a couple of months just to show me where you're up to?
Yeah.
Not
so
on a
no-
formal
Oh,
manner,
okay.
just
yeah, okay.
bring a logbook and come and see me and we'll just make sure that everything's running along to plan, okay?
Yeah.
Anybody else have any other comments?
No, it's well done.
Make sure you get the exams out of the way and, that'll give you ample time to do other things to make yourself comfortable in the ST3 interview. I'm sure you'll be fine,
Mm.
just work to it.
Do you know what you want to do?
General surgery.
Okay.
Kind of excellent.
Good, okay,
Long-term aim.
alright, good.
Uh,
Well, I'm sorry you had the difficulties you had this year, but you may look back in the future and realise that you've generated opportunities out of this that you weren't expecting, so well done.
Thank you.
Well done.
Good.
Well done.
Thanks so much.
Okay,
Thank you.
bye.